If a patient is having a knee problem, the first and foremost, the image we go for is actually the X-rays. And same is the case with the patellofemoral knee pain. That is, that we go for X-rays, AP, and lateral view of the knee joint. Although certain other X-rays like sunrise views and merchant views can also be done because we are suspecting the patellofemoral joint pathology. Therefore, to best assess the patellofemoral joint, usually we have to go for sunrise or merchant views as well. Now, once we go for X-rays, what we need to see on AP are the lateral view as well. Now, this is an X-ray, a sunrise or merchant views of the knee joint, which is actually showing the trochlear groove. These are the medial lateral patellofemoral condyles, and this you can appreciate the patellar dome as well as the undersurface of the patella. This surface actually articulates with the trochlear groove. And if you can appreciate it over here, this is actually almost in contact with the one of the lateral femoral condyles or medial femoral condyle as well. Now what happens is, usually when the cartilage is present, it actually glides past easily. But if the cartilage has eroded or it has damaged or there is inflammation over there, when this will go past each other, the result in that subchondral bone will collide with the subchondral bone of the other bone, and this will actually result in sort of a mechanical microfractures leading to pain and eventually development of the patellofemoral pain syndrome. What we need to see on these X-rays is that if you appreciate clearly, you can appreciate increased lucencies, sclerosis over here, as well as some degree of osteopenia in the subchondral bone. Compared to this side, you do not appreciate increased sclerosis and osteopenia, but on this side, you can appreciate that. This is usually classically seen on the lateral as well as the sunrise or merchant views as well. And if you see it on the lateral view, you can also appreciate some sclerosis as well as subchondral osteopenia as well. These are the signs of development of arthritis, which will eventually lead to patellofemoral pain syndrome as well. Certain other parameters which we need to look at when we are looking at AP, lateral, and sunrise merchant views is that usually we need to look at the malalignment as well. When we are looking at the AP view, we need to make sure that patella is actually centered over the knee joint and it's not lateralized or displaced or dislocated as well. Similarly, on the lateral view, we need to calculate the Insal-Salvati index. This is actually this ratio between the patellar surface as well as the patellar tendon length. If you calculate, this is the length this is the A, which is of the patellar surface, and B is the patellar tendon length. Usually it's B divided by A, and you calculate certain ratio. If the B is quite small and the patella has come down, this is called as patella baja. This would increase actually the arthritis and eventually lead to patellofemoral pain syndrome. Or if it actually goes up, this is because it's called as patella alta, in which the patella is actually higher heading patella, would produce instability of patella, eventually leading to malalignment and eventually leading to patellofemoral pain syndrome. So when we are looking at the X-rays, we have to look at all the views, that the AP, lateral as well as sunrise views. We have to look at the alignment, we have to look at the bone overall in general, as well as we have to look at this, is there increased sclerosis or joint space narrowing, or is there any subchondral osteopenia present or not. Therefore, by looking at it, we can judge that probably this patient has patellofemoral pain syndrome or arthritis. Before imaging, this on the X-rays is not enough. Other imaging, we can go for CT as well as MRI. Before we move on towards arthroscopy, we have to sometimes we have to get CT as well as MRI as well. In our case, we did go for MRI, and we did find out that there was actually a thinning of the cartilage and there was a bone bruise. What happens is that when we are going for MRI, there is an outer bridge classification called as for chondromalacia patelli or patellofemoral pain syndrome. This had certain stages. For example, stage 1 outer bridge is when there is only thinning of the cartilage. This is when very early on in this disease, usually there is increased edema, there is increased fluid retention, and increased signal intensity on the T2 weighted MRI. In Type 2, there is actually the softening and thinning has occurred, but now the fissures are formed in the cartilage. This may present with inflammatory response of the cartilage and increased synovial fluid retention, and the patient may present clinically with some degree of knee effusion as well. In grade 3 outer bridge classification, it actually results in a crab meat kind of appearance over the MRI. And in grade 4, there is actually destruction of the cartilage as a whole with exposure of the subchondral bone. Now with grade 4 injury, that practically means that subchondral bone is exposed and patient will eventually develop arthritis later on. Therefore, once we have done the CT and MRI, sometimes CT is also required, because when we are looking at the cause of patellofemoral pain syndrome, this could be underlying malalignment, or this could be patellofemoral instability. So we may have to go for CT to calculate actually the TT and TG ratio as well. Therefore, first we go for X-rays, then for CT or MRI, and then we may have to confirm our findings on arthroscopy. And whenever we scope in, usually diagnostic arthroscopy is rarely done because of MRI. But if we go for a diagnostic arthroscopy, what we usually find is that if you see this trochlear groove, this is the undersurface of the patella, you can appreciate furriness over here, which means there is actually some degree of the loss of cartilage over the undersurface of the patella. Usually the hyaline cartilage appears like a pink one, but if it's appearing white, this usually means that there is some degree of loss of damage to the cartilage over the undersurface. So when we want to view if we are suspecting patellofemoral pain syndrome, first and foremost are always the X-rays. On X-ray, we have to look for the malalignment of the patella, fracture or dislocation. We may have to look for the subchondral sclerosis and subchondral osteopenia. Then on CT, we may have to calculate the TT and TG ratio to exclude patellofemoral instability. Then on MRI, we may have to look for what exactly is the outer bridge classification, how much thinning is there, how much edema is there any bone bruises over the medial and lateral femoral condyle, and on especially on the T2 weighted MRI. And we may have to culminate our findings with arthroscopy and confirm our findings with arthroscopy that exactly what we were suspecting is present. And we may also, once we have gone in with the scope, we can also partially treat this disease as well.